From a new syndrome in kids linked to COVID-19 to how the coronavirus is impacting emergency visits for children and the toll it's taking on their mental health. WWJ Health reporter Dr. Deanna Lites goes one-on-one with the new CEO of Children's Hospital of Michigan.
Kathy Donovan is the new CEO of Children's Hospital of Michigan. She's been in the top spot for about 5 weeks and comes from a children's hospital in St. Louis. What a time to start a job during a pandemic.
I never imagined I would be moving across the country in the middle of a pandemic. I mean, just even moving through the gears of interviewing for a job, like all of our lives have forever changed because of this, and how we do things and conduct ourselves is completely changed. It's good that everyone across the nation is approaching things the same way when it comes to COVID. The CDC is really guiding how hospitals and healthcare systems respond to this. So coming on board was just like picking up where I left off in terms of how do we cope in this new normal and how do we take the best care of our patients and families for what is going to be around for a while. This isn't something that's going away anytime soon.
Are there any children with COVID-19 in the hospital?
Right now, our numbers are really dwindling across the entire DMC, and so currently we do not. The syndrome, pediatric multisystem inflammatory syndrome, Detroit was one of the hot spots for that. We watched in, mid-Missouri what was going on here, because really the Children's Hospital of Michigan set the pace for how we care for these kids, because they were the leaders across the entire nation for it in terms of research and the therapies that they come up with. So of all the cases that we had of MIS, every single child walked out of this building, which is incredible. And some were so very sick, especially in the beginning. They went on bypass and life support and spent lots of time in our critical care unit, and they walked out of here with their families, which is incredible work. And I believe moving forward, the physicians from the Children's Hospital will lead the way for everyone else across the nation to follow of how to treat these kids.
Mental health experts say they're treating more patients due to the COVID-19 pandemic. What are you seeing in children?
Deanna, we're already seeing an increase in behavioral health patients in our emergency room, and it's across the spectrum. Some of it is just the fear that COVID brings. Children don't understand a pandemic. A lot of it is related to isolation, children not being able to stay in a normal routine. So behavioral health just in general is a large issue, not just for Detroit or the state of Michigan, but across the entire United States. Pediatric behavioral health is especially challenging. We just don't have the right number of beds for kids who need treatment. And so we're actually coming together with the other children's hospitals in the state, and we're working really closely with Larry Burns at the Children's Foundation to try to figure out how do we impact this, how do we take better care of these kids in our community for the long haul. For the immediate term, we have 2 special spaces within our emergency department where we treat these children, and we are working our way through the increased demand, and we anticipate this is going to continue versus letting up.
Because of the pandemic, fewer adults are going to the emergency room because they're worried that they might catch the coronavirus. How about children's emergency centers?
What we're finding is, the ED volume has really declined post-COVID. So we are absolutely out there encouraging through community communication and communications through the primary care physicians that kids, especially kids with chronic conditions, really need to get back to receiving care, whether that's through, the clinic space, their primary physician, or through the emergency department, because what we're finding is folks are waiting so long to bring their child in. Once they're here, they're extremely ill. Our acuity has gone up so much within the hospital, and it's directly related to some of these factors. So we're really encouraging parents and guardians to seek the care their kids need, because as we know, all the kid emergencies don't pause for COVID or a pandemic. They're still happening.
Dr. Deanna Lites, WWJ Newsradio 950.